Hello and welcome back to Office Hours, where I answer your questions about weight and weight medicine. I'm Dr. Meghan. I'm a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually talk to patients about their weight all the time. I actually prescribe these medications all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medicines, and if you want medically based answers to your weight questions, you are in the right place. Welcome. Before we get started, I have an announcement. If you are on a GLP-1 and your relationship with food is a bit chaotic, disorganized, kind of a hot mess, or you can't get yourself to exercise, or you're not on a GLP-1, but you want to make sure you're never on a GLP-1, consider this your sign. It's your lucky day. I'm doing Consult Week, the week of May 4th. If you've ever been curious about how coaching can take your weight goals to the next level in a very short amount of time, you're in luck. Right now, I'm booked through the end of the month. The end of May, all gone. So I opened up this window of time the week of May 4th. So if you've ever been curious, grab a spot. It's free. Last time I made this announcement, all the spots were gone. So stop this video now, actually. Stop it now. Go get a spot, then come back and watch the video. Click the link below or click the link in bio, and let's talk about how to get you feeling better. All right, let's get to the questions. As always, I can't answer personal medical questions because I'm not your personal doctor, but so if your question does lean a little personal, I'm going to change it so it's more broadly educationally appropriate, and we'll go from there. Sound good? Let's go. Okay, first question. My highest dose was 10 milligrams Mounjaro, but I was still losing weight, 10 pounds. I asked to titrate down to 7.5, still lost weight. So I went to 5 and I'm maintaining. Was this a bad idea? So in theory, if I have a patient who's hit their weight goals and they're moving past them, they're now progressing into a space where they're losing more weight than we agreed was a good idea for them. They don't really feel comfortable. They feel like their weight's a little too low. That's not the direction that they wanted to go in. I will usually dial it back. And sometimes you have to dial it back quite a bit to make sure that you're in the BMI range that you really want to be in. So for me, if I have a patient who's lost more weight than we think is good for them, I will dial it back. And then you're watching and waiting and seeing what happens. You won't know right away. For some people, I do have to play around with the dose to figure out where they're going to be best in maintenance. And that depends on the weight loss achieved, the side effects that are happening, how they're feeling. So once you get close to maintenance, it is a little bit of a, fluctuation. Like things may go up or down a little bit. I may have to play around with the dose to get it right for people. So for me, if I have to dial it back a couple of dosage strengths, I don't usually feel like that's a problem as long as the patient is getting where they need to be. So for me, there's no right answer in terms of what dose should this person be on at the end. It's really what dose is achieving the goals that they have. So if I have a patient on 10, they're still losing more weight than they anticipated, I have no problem bringing it back to 7.5, 5. But it is going to take a little while for me to see. It's going to take at least a couple weeks to see what's going on in terms of their weight and what it's doing on those doses. So I always tell patients, just be patient. These medications have a long half-life, and sometimes I just have to play around with the doses a little bit to find where it's going to work best for that person. Next question. I have nodules/goiters on my thyroid. Can I still take a GLP-1? P.S. I can't afford the brand name being on Medicare, so I'm not really sure where to go. Any advice? Thanks again. Okay, so there are a couple contraindications for GLP-1 medication in terms of your thyroid. So if I have a patient and they have a personal or a family history of medullary thyroid carcinoma or multiple endocrine neoplasia type 2, that's a very specific type of genetically linked thyroid cancer. If they have anything like that in their personal history or their family history, it's not going to be a good fit. Because in rodent studies, there's a question of, does this increase the risk of those types of cancers? Now, rodents are different than people, but it's enough so that for me, for most doctors, we are not going to be comfortable taking that sort of risk on. At that point, I think the risk outweighs the benefits. Also, if I have a patient who has an undifferentiated, like we're still working up, we still don't know if they have a thyroid cyst, a thyroid nodule, an enlarged thyroid, and we're still not sure what's going on, that for me is not the time to start a GLP-1 medication. If it's still unclear if this could be potentially a cancerous lesion, I'm not going to start this medication then. That's very different than a known cyst or a known nodule that I'm following, because thyroid cysts, thyroid nodules are not actually that uncommon. And so if I've already figured out what the cyst is or what the nodule is, and I'm just watching it, but I know that it does not look concerning for something cancerous, then I'm comfortable starting a GLP-1 medication. But again, if I'm not sure what it is yet, that's not the time to start. If I know and I'm just monitoring it, I know it's not something cancerous and I'm just monitoring it for change and it's stable, then I do feel comfortable starting a medication. And then in terms of Medicare patients, definitely talk to your physician about oral medications, generic liraglutide, but also check out the Lilly Direct. Again, I'm not sponsored. The vials, I have a lot of Medicare patients who are on them, and it's a really good, it's not, the price isn't like the best, but it's not nothing. It's not like the $25 insurance copay, but it's much less than fully out of pocket. So check out the prices on Lilly Direct. It's about $350 to $500 out of pocket per month. But again, that's not like over $1,000 per month. So for some patients, it is a good option. But also talk to your doctor about generic liraglutide and oral medications too, if those might be suitable for you. Next question, you said Orforglipron would be the first oral GLP-1. What about Rybelsus? Great question. I am happy to clarify. So currently there's no GLP-1 oral medication that's FDA approved for weight. There is an FDA approved GLP-1 medication that's oral, but it's only approved for diabetes. In my experience, it does not get great results at the current doses for weight loss. However, there are studies, and I've made a lot of videos about Rybelsus, so you can definitely check them out on the channel. There are studies, and it is in the works to see if Rybelsus can get approved at higher doses for weight loss. Now, from what I've seen, there's definitely side effects when patients are just on the lower doses of Rybelsus, but we'll see. It very well could get approved for weight loss at higher doses, but that has not happened yet. So who knows? Rybelsus might get approved first. Orforglipron might get approved first, but currently we don't have any oral GLP-1 medication that is approved for weight loss. Next question. I am thinking about switching from Ozempic to Phentermine. Feeling too sick on Ozempic. How long do I have to wait to start Phentermine after I stop Ozempic? Thanks so much. Okay, so first of all, you're so welcome. Second of all, if I have a patient who wants to switch to something like Phentermine, first I'm just going to make sure that all the side effects from Ozempic are worked out of their system. I really want to make sure they're feeling normal again before I start them on another medication. Also because I don't want any confusion about like if they have side effects on the new medication, I want to make sure I know where that's coming from. So while for me, I certainly could have a patient stop Ozempic and start Phentermine the next day, I really wouldn't if they were having side effects, because I want to make sure I know where they're coming from. So for me, there's no hard and fast rule. Patient will come off of it. How are they feeling? Do they feel normal again? We review all the Phentermine side effects and the possibilities, and then they would start the Phentermine, and then I would watch and see if they're feeling better. Now, the nice thing about Phentermine is that it works only in the brain. It's not working on the GI tract. So you do avoid a lot of the side effects that you have with the GLP-1 medication because it's not so directly affecting the gastrointestinal system. And also the nice thing about Phentermine is that the half-life is much shorter. It's a daily medication. So while that's annoying for some people, in another way, it's nice because if I have a patient who does have side effects, they can just stop it. And I know the side effects are going to likely go away pretty quickly. So what a great question. Thank you so much for asking. If you have questions afterwards, please leave them on this video or on another video, and I'll add them to the list. I'm still doing daily YouTube shorts every day for April. If you want to work with me directly, like I said, I will leave that link down below. And you can also click the link in my bio to make an appointment. And I so look forward to talking to you. Thank you so much for watching. If you're not subscribed already, subscribe, because this is the place for medically based answers to your weight questions. Thanks so much for watching, and please be well.